In this lecture, we turn to egalitarian justice, a theory of justice grounded in the conviction that all persons possess equal moral worth. While distributive justice focuses on how resources are allocated, utilitarian justice prioritizes outcomes, and libertarian justice emphasizes freedom of choice. Egalitarian justice asks a more foundational ethical question: how do we ensure that every person is treated as morally equal, regardless of social or economic status? Egalitarian justice holds that justice begins with human dignity, not utility, productivity, or market value. In healthcare ethics, this perspective has been especially influential in shaping policies aimed at fairness, access, and protection from discrimination. At its core, egalitarian justice affirms that all individuals deserve equal respect and consideration simply by virtue of being human. This does not necessarily mean that everyone receives identical care in all circumstances. Rather, it means that morally irrelevant differences, such as wealth, race, gender, disability, or social status, must not determine access to care or quality of treatment. Egalitarian justice resists the idea that some lives are worth more than others based on social contribution or economic productivity. A central application of egalitarian justice in healthcare is universal access to basic healthcare. From an egalitarian perspective, access to essential healthcare services should not depend on ability to pay or social position. Basic healthcare is often understood as a requirement of justice because it protects fundamental human functioning and dignity. This view underlies arguments for universal health coverage and publicly funded healthcare systems. The moral claim is not that everyone should receive all possible care, but that no one should be excluded from essential services. Egalitarian justice also underpins anti-discrimination protections in healthcare. Legal and ethical standards prohibit discrimination based on race, ethnicity, gender, religion, disability, or socioeconomic status. These protections reflect the principle that differences unrelated to clinical need must not affect care decisions. Anti-discrimination policies are not merely legal safeguards. They are expressions of moral commitment to equal respect. They reinforce the idea that healthcare professionals have ethical obligations to treat all patients with fairness and dignity. Another important application of egalitarian justice is equal treatment standards. Equal treatment does not require identical treatment, but it does require that clinical decisions be guided by medically relevant factors rather than social judgments. For example, two patients with the same condition should receive comparable care regardless of their income, education level, or insurance status. Departures from equal treatment require ethical justification grounded in clinical need, not social worth. Egalitarian justice also plays a critical role in shaping institutional policies. Standardized treatment protocols, equity audits, and efforts to address health disparities reflect egalitarian commitments. These measures aim to reduce unjust variation in care and ensure that systems do not systematically disadvantage certain populations. In this way, egalitarian justice extends beyond individual clinician behavior to the design of healthcare systems themselves. Despite its moral appeal, egalitarian justice faces practical challenges. Critics argue that strict egalitarian approaches may strain limited resources or fail to account for differences in need or benefit. As a result, egalitarian justice is often balanced with other ethical frameworks, such as utilitarian or distributive principles. Nevertheless, egalitarian justice serves as a moral anchor, reminding us that efficiency and choice must not override respect for persons.